We've just talked about smoking's contribution to lung cancer, but it is also a common denominator for a variety of other lung ailments. Chronic obstructive pulmonary disease, or COPD, is an umbrella term used to describe a variety of lung diseases, including emphysema, chronic bronchitis, and non-reversible asthma. Over time, patients with COPD are at an increased risk for developing lung cancer because of existing impairments in the lung function. COPD symptoms often don't appear until significant lung damage has occurred, and they usually worsen over time, particularly if smoking exposure continues. Symptoms can include shortness of breath, especially during physical activities, wheezing, chest tightness, and having to clear your throat first thing in the morning due to excess mucus in your lungs. Ed Nusel, board-certified nurse practitioner at Allergy, Sinus, and Asthma Family Health Center, talks about COPD and how it's treated.
COPD is one of those diseases you just can't look at somebody and say, okay, you have COPD. COPD is actually a chronic obstructive pulmonary disease. It can include things like asthma, chronic bronchitis, emphysema. So it's kind of a cover term in the fact that a person's airway does not actually return to a normal state after we give them a bronchodilator that will assess as to whether somebody falls into the range of COPD, and then when we look at their spirometry, that will tell us how severe the COPD is. Now, spirometry is when you go into your provider's office and they have you breathe in this machine and they're actually looking for your pulmonary functions. That tells us how much air did you get out, how much did you get out the first second, and then that ratio is how we measure whether you have COPD, you don't have COPD. And so when we look at that ratio, and when it goes below 70%, that's the diagnosis for COPD. And one of the big symptoms that you see is shortness of breath, difficulty getting a breath. And although COPD is associated with a history of smoking, smoking is not the only thing that can cause COPD. But anybody that is experiencing the shortness of breath that smokes, I can't tell them how important it is they need to stop like now, because this is a progressive condition if they continue to smoke, and it can get worse.
To get in touch with Ed Nusel and the staff at Allergy, Sinus, and Asthma Family Health Center, please visit our specialist directory. Just click the COPD Explain tab on our homepage, yourhometownhealth.com.